Now, working from home could increase the risk of drug abuse and alcoholism. That's the warning from the world's most expensive mental health clinic. Jan Gerber, founder of Paracelsus Recovery in Zurich, who treats high net worth individuals, says people are resisting returning to the office in the belief that remote working may have helped the mental health, but actually, they may actually suffer in the long term. Well, let's speak to Jan Gerber, who joins us now live, as you can see, from a very picturesque Zurich. Very good afternoon to you. This is all quite serious, isn't it, in many regards? What you're saying is that this idea that actually working from home, having that space, actually kind of cuts you off, I assume, and does have an impact on your mental health.
Well, absolutely, Darren. It's a clear insight in psychological research that loneliness, is by far the biggest issue when it comes to mental health and health in general. And obviously, there is a much bigger risk or degree of loneliness when you work from home, no matter if you have some family members around or not.
And is it loneliness primarily that you're seeing is driving people to addiction here? Because we're talking about potentially people risking drug abuse or alcoholism.
No, absolutely. So loneliness is one thing that creates pain, and the pain people look to medicate that pain, and often the choice to do that is alcohol or medication or drugs. Another issue is just a lack of structure, and kind of a lack of having to show up at certain time in the office. So if your first meeting is, I said 11 a.m. before then, it kind of blurs a bit the line between actual structure and work and your free time at home.
Now you run this mental health clinic in Switzerland. Is this something that you're actually seeing, or is there more widespread evidence for this happening? Well, essentially, I'm asking where is this sense of what you're getting coming from?
So we've seen it. There is also some studies, mostly from the US at this point, showing that workers from home, they have a 20% incidence rate of substance abuse, which is quite significant. And we should see, so we project from what we see in our patient population, and from those studies with general psychological research. So that, we know that structure is important. We know that loneliness is an issue. We know that blurring lines between work and social activities and family time, that all this is problematic for mental health. So as a conclusion, it can be very safely said that working from home poses significant risk for mental health.
No, I think it's fair to say that your mental health clinic is not cheap. I think that's fair to say, isn't it? And wealth doesn't protect you from many of these strains, does it? You are seeing some of the most wealthy and successful people in the world.
No, 100%. So in the end, we're all human beings. It doesn't matter if your job title is CEO or if your job title is janitor. And actually, wealth often creates a lot of additional problems. There's a lot of, and especially in the workforce, in the working world, expectations and pressure, they're significant at the top levels, of course.
And is this linked to COVID? I know COVID in many ways, and this is why it's quite difficult to disentangle, isn't it? COVID obviously accelerated the working from home trend for many, many people. And for lots of people, they've gone back to the office, others haven't. But it also, and we saw lots of evidence this week, that it had an impact on people's mental health, irrespective of whether they caught COVID or not. And so COVID seems maybe to be the trigger for these things, but in different ways for different people.
Well, 100%. So COVID was a turning point, of course, and it's, apart from the anxiety and the social isolation that came from that, now we see years later still the impact of just a shift of how people work, and some of the things that did fall away. Again, it's the structure and the social interactions that have really, with COVID, completely diminished in many industries. And I do understand, we all understand that it is comfortable to work from home. You don't have to commute daily. You also don't have to interact maybe with some obnoxious colleagues and so on. But in the end, a lot of people, they confuse comfort with mental health pressure, and confuse that or mistake comfort actually being good for their mental health, because we need to, go out of our comfort zone also to grow and be healthy and become more resilient. And also that has also been taken away with working from home.
Jan Gerber, live there for us in Zurich this afternoon. Appreciate your time. Thank you very much.
Thank you.
Thank you. OK, that is